Well, I'm here with Patty, who many of you may know is our nurse who does our pre-op appointments. And we're here to talk about her experience with her facelift. She had a facelift, a neck lift via the extended deep plane approach 7 months ago. And Patty, tell me how things have been going. How's it been?
Great. Everything's been going wonderful. It's exactly what I thought it was going to be. It's exactly what I've been telling all of our patients all these years. So I think I had a little advantage maybe on that part, just because I knew what to expect, and it was exactly what you tell patients, exactly what I tell patients, and it was, I would say, easier than patients think.
Oh, wonderful. And what was your driving motivation to get this done? When did you start thinking about it? And tell us about that process.
I really started thinking about it more seriously when I started working here with you, seeing your good work with other patients, and I was able to see patients before their procedure, and of course creating those relationships with those patients, and I was able to also see their great results. So being able to follow those patients before and after their journey, not just the first couple of weeks, but even months after their surgery, I could still see the wonderful results. So it really inspired me and confirmed my wish to do it.
Great. And now you'd been doing a lot of pre-op appointments with our patients before, giving them all the information that we gave you. But then after going through the process yourself, was there anything you learned that you said, okay, now that I've gone through it, I know I can add this? Like, what are those things that you added to the information you give patients after having gone through the process?
I think just the level of comfortable not having pain. It's not a painful procedure. It feels tight. Of course, you have tightness and swelling, but it really opened my eyes that it really is not a painful procedure. It just confirmed again what I was thinking all along.
Great. And what was the first day you said, all right, that's it, I'm putting on my makeup, I'm going out, I'm ready to show this off to the world?
I would probably say that week after. The sutures came out at post-op day 7, and post-op day 8, I put a little makeup on and was ready to go. I can tell you that it was 2 weeks after surgery that I went to the DMV and had my driver's license picture taken with the DMV even 2 weeks after surgery. So I was really impressed by that.
So Patty, you've also worked at many other surgery centers before in plastic surgery. Tell us about your experience at ARIA Plastic Surgery Center and how that was for you.
Very well organized, and I am glad to be a part of helping everything to be organized with surgeries, from even after consultation with pre-op, keeping in touch with that patient before surgery and as far as after surgery. But here at ARIA, everything flows very nicely. We all have our roles, what to do with each patient, and that really shines because everybody knows their role, and it makes it flow nicely and work well.
Great. Yeah, and I think one of the biggest compliments we get is nurses and physicians and other people in healthcare that have many options come here and they comment about how well run it is. So not just the people who are internal, but from the outside, that's always the biggest compliment. And people who see it every day know the excellence that we try and bring every day to our surgery center. So oftentimes when we undergo any facial plastic surgery, it's very normal. We tell our patients to expect different emotions the first few weeks after surgery. It can be hard to have surgery on your face, look in the mirror and see all this bruising and wonder why you chose to do this electively. But it's part of the natural process. We warn our patients about it. And for many, it's not an issue. Patty, tell us about your experience. Did you have any of those emotions during your recovery?
No, I did not. I was very happy from the very first night and followed your instructions as far as taking it easy. My emotional state was, I'm so glad I did it. I've been wanting to do it, and I'm so glad I did it, and it was a perfect time.
So patients often tell me when they are done and fully recovered, wow, this changed my life. Tell me a little bit about, has this changed your life in any way for the better?
Yes, I look in the mirror and see myself how I see myself, not as older, not as too young, but just right. So I feel like I'm just right when I look at myself. I feel like my appearance matches how I feel inside. That's exactly what I wanted.
Wonderfully said. Well, we're excited about it because, yeah, your facelift looks amazing, looks beautiful. Thank you for giving me the opportunity to do it for you. So, any parting advice you'd give to anybody considering coming to our practice to consider getting their face and neck lift done?
Don't second guess, just do it, because if you keep putting it off, you'll be scared for no reason. Just like everybody says, oh, I wish I had done it sooner. Why was I so afraid? It's so easy, easier than expected, and don't hesitate, just do it. You'll love it.
Well, thank you, Patty. She's a testament. And when you guys book surgeries, you'll be able to do a pre-op with Patty, and she'll show you all those incisions and how beautiful they are. I think patients that see her 2 weeks before their surgery take a look and they're so encouraged and ready to go. Their nervousness kind of dissipates once they see the incisions and the beautiful result. They know that they are going to get a wonderful result. That's what we're here for.